Good morning, everyone. My name is Dr. Vamsavardhan Reddy, consultant physician, diabetologist, and geriatrician. On this World Heart Day, my objective of talk is about heart attack, its causes and preventive measures, one who can reduce the incidences of heart attack. The heart is a vital organ in our body which delivers blood to each and every organ, works as a pump, and its non-stop functioning is very crucial for survival. If there is a reduction of blood supply or oxygen to the heart for even few seconds, there is a chances of heart attack and heart failure. And we all know what kind of pandemic situation we are facing with so many stressful lifestyle with risk factors leading to increasing in the incidences of heart attack in India. And what are all the risk factors will give this heart attack? If you see, the most important one is the high blood pressure, and there is an uncontrolled diabetic status and increasing abnormal cholesterol, overweight, smoking, alcohol, and last but not least is the reducing the sleep and stressful lifestyle. So if you go to the whenever there is a high blood pressure and uncontrolled sugars, which damages the inner layer of the blood vessels, leading to abnormal deposition of the cholesterol and giving rise to narrowing of the blood vessels. So whenever there is a high demand of the blood supply to the heart, and with reduction in the blood supply to the heart, leading to heart attack or heart failure. So we should be aware of the symptoms. What are all the things alarming towards the cardiac attack? The number one symptoms I would like to say is central or retrosternal chest pain, and it may not be pain all the time. It can be like a squeezing type, choking type, heaviness in the chest, or sometimes it can be even burning, which can mimic like a gastric symptoms. And this chest pain can radiate to the neck, jaw, and even to the hands. And it is associated with breathing difficulty, or there can be nausea and vomiting, or there can be racing heart sensation, or there is a excessive sweating and fainting or lightheadedness, giddiness kind of feeling. These multiple symptoms will vary person to person. Sometimes even there won't be any chest pain. Patient can come with the just excessive perspiration and vomiting sensation or some kind of discomfort in the chest. So any kind of this alarming symptoms immediately should seek to the hospital for the cardiac evaluation. So the one who can follow the preventive measures by healthy lifestyles can reduce the incidences of heart attack. The number one point regarding the healthy lifestyle is healthy diet. So if you see in the healthy diet, increasing the fruits and vegetables is very, very important factor to reduce the risk of heart attack, where there is a increased fiber intake and increased intake of the nuts and reducing the carbohydrate content and sugar beverages. The number two important healthy diet is reducing the high saturated fatty acids and increasing the intake of the polyunsaturated fats. So if you take that saturated fats, which we need to reduce is the animal meat or cheese, high fatty meal, and or we need to cut down and increase the intake of vegetable oils like sunflower oil, olive oil, or tropical oils. And we need to cut down, very important is highly saturated or highly processed foods we need to cut down. And the next important thing among diet is the salt. We should, someone who is a hypertensive, according to WHO, the salt content to allow for 24 hours is the 2300 milligrams per day. The one who has an uncontrolled BP, the limitation of salt should be less than 1500 milligram per day only. The next important lifestyle changes should be the regular exercise, and we need to keep our body weight in an optimal way. We should keep our body mass index in an optimal way. So the regular exercise, according to WHO, it is recommended to do for a person is 2 hours 30 minutes per week at least, with respect to the moderate exercise. The one who can do high intensity exercise like a jogging and heavy exercise, it is around 90 minutes per week is enough to keep. This 2 hour 30 minutes and 1 hour 30 minutes is the minimal at least to maintain to reduce the incidences of heart attack according to WHO. The one who has a joint problems or diabetic foot issues in elder age, where there is the better exercise should be cycling or swimming kind of things. So by doing regular exercise, automatically it reduces the calorie burning. At the same time, it increases the toning of the blood vessels and reduces the blood pressure, and moderation of the cholesterol can happen. So with these things, we can maintain the body weight in an appropriate way. The next important thing is we should encourage to quit smoking, and there is a limitation of alcohol is very, 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 very important. And last but not least is the managing the stressful lifestyle with reduction of the stress and increasing the sleeping hours is very important. Present generation and present lifestyle. So with this, managing the healthy lifestyle by maintaining the healthy diet with regular exercise, with reducing the blood pressure, with controlling the sugars, we can reduce the incidences of heart attack effectively. Thank you, audience. Thank you for listening. Thank you very much.